hard time going through the motion of flexion and abduction of the shoulder. I'm gonna have you scoot to the edge there. And it's his right arm that's having a hard time, okay? Very simple. We're gonna come back here, we're gonna stabilize his scap, come across, and then do a posterior glide of glenohumeral joint, or the humerus, excuse me, okay? So we do that posterior glide, and then I'm gonna have him just go through the motion of up into flexion, and I just follow along, again, trying to maintain that posterior glide, and then back down.
I won't interfere with his.
As long as I'm kind of going with him and still getting that posterior glide, then we should be okay. And you can kind of get out of the way if you need to, have him go more of the scaption if you need, but in that posterior glide, and then he goes through the motion again.
Could you stand on the other side?
Yeah. Could, but then I really got to move my arm out of the way to make sure I'm not inhibiting him from going into that motion. If I now my arm's stopping him, right? So then I really have to come up and follow him along. It's just going to be easier here than I just have to move my hand. Okay, so that's one way to do it.
I mean, it is a sensitive area potentially,
Yeah.
where people might not want your hands, and so I definitely can see that. And if you looked at what his fingers were doing when he came to the other side, essentially to follow it, he was kind of doing this number, which most ladies might not be too thrilled about. Some do doing that.
Yeah.
But at the same time, they might also not want you
Not want him
reaching around and going, what's going on here? So
So what did you? You can't do either of those.
make sure you have permission.
Yeah.
Make sure you let them know where your hands need to be to do it properly, what the purpose of the goal is, why we're trying to do it, and make sure they're okay with it. And let them know that if they become uncomfortable with it, then we can stop. And maybe see what we can do a different way with the strap or something like that, so it's not his hands.
Well, at the beginning of the semester, it was like the second week or something when you were gone, Susan showed us one having the patient just sit in a chair like this, and you're standing behind them. Was that for the same?
I think that was just for the joint mobs themselves, not necessarily the mobs with movement.
So would it still work with movement though? If you do the joint mob and then have them do abduction or?
And I can't remember exactly what she did.
I don't either.
I wasn't here.
It was just like a doing something on the back. Because then she mentioned that she would do it on herself, up with her abduction. Does that make sense?
In it, like if all she's doing is pushing back, the thing is you have to stabilize the scap.
Yeah.
So, because if I just push back like that, now my scapula is retracted, and so therefore the whole joint is now moved backwards.
Yeah, so if you can stabilize the
Not quite
scapula,
as-
though,
Yeah.
that would still work.
So like have them lie down or something like that, or
If you had a high enough
high
seat
enough
back
chair.
on it, they could compress back against it.
Could you just manually stabilize your scapula with your other hand?
Yeah.
So would it, that accomplish the same effects as?
As long as they're getting a good enough posterior glide. I mean, I was pushing pretty decently.
And then the other thing is, the way Johnny's doing it, he's able to push with more the heel of his hand, which is a broader, flatter surface. If you're coming from behind and you're trying to use more your fingertips, then that's more distinct points of contact. It tends to dig in a little bit more, just a little bit more uncomfortable, and also a little bit more personal than using the flat of your hand or the heel of your hand. So that's another kind of pro for going that way. It's definitely less invasive to come behind him and do it that way and potentially just have your fingers there. It may or may not be quite as effective for a couple of those other reasons. But there's lots of ways to do lots of these things. Yeah, for sure.
Yeah. So another way, if they're not comfortable with us reaching across or putting our hands in that area and we don't have a mobile, you can use a towel. Just get relatively skinny, so don't keep it like too wide. Even that, depending on the patient, that might be too wide. So I kind of fold it over again. And then I can come in I get right on his humeral head, I stabilize that scap, and then pull posteriorly and have him go through as much motion as he can.
Yeah, that's
Okay. Yeah, but again, now I'm using, this is acting more like the palm of my hand instead of like correct touch. I'm using my fingers. Okay.
From the therapist standpoint, you lose that tactile feedback that you get when you're actually in contact with the person, but it's definitely less personal.
Yeah.
Might be a little bit harder to precisely direct your force with that compared to using your hand.
Or you can do the same thing with the mo belt. Very similar to the towel, where we're just going to wrap it up and around. And now I can clamp down pretty good on it, so I have really good control, stabilize that scap, do posterior glide, and have him go to elevation. This is the same thing that you would do for external rotation as well. So maybe I can get him up into abduction, or even here, doesn't matter. As long as I get that posterior glide, then I can have him come up in that, there you go. And then as I get that posterior glide, I just have him go into external rotation. Okay. So that's for elevation and external rotation. The only one that's a little different, you can do it for internal rotation as well. However, they suggest you do an inferior or a caudal glide for internal rotation instead, which looks like this. I'm going to have you stand up for this one. But we want to get a little bit of distraction for this one. So what we do is we roll up a little towel. We're going to have our patient just kind of stick it up in the armpit, just like this. Okay? And even just having him hold it and push down gives a little distraction up here. Okay? But we're going to give a little bit more as we go through the motion. And I'm going to have him, and a lot of it depends on how much internal rotation they have. Okay? Because it takes quite a bit of internal rotation to get to this position anyway. Okay, so if it's maybe he's lacking just that little bit of end range, then this is great. Also, if there's pain with the motion, but he can still get into that position, we want him to ideally get into a position where maybe they're like, wiping their butt or something like that. And then with my body, I'm gonna push up against him a little bit to create a little bit more distraction, but then with my hands right at his elbow pit, I'm gonna do a caudal or inferior glide. And then have him just simply try and work his arm up his back as far as he can go. And that's gonna put him into more and more internal rotation. Okay? Sometimes you might see people trying to do it with a belt. I think that's a little tough. Number one, because you gotta have the belt really long. You're still gonna use the towel. But now, excuse me, going on like that. And then what you end up doing is using your foot kind of like it's on a gas pedal to help you get that inferior glide. And then again, he tries to reach up his back a little bit more.
So it looks like you might be compensating a little bit. You
Yeah.
don't need to stabilize the top at all anywhere.
That's why I have a hard time with that one, because it gives me less control, less ability. So here, I can make sure that I'm getting good pull down, whereas the belt was kind of sliding down his forearm, and maybe that's what he was trying to compensate for, was making sure that belt wasn't going
Like
anywhere.
his trunk was actually
Right.
going like that.
But here, now I can make sure it's nice and stable, and I can control a little bit more. So I prefer this one. The belt, some people like it just because they can just step on the belt to get the glide, but you lose some control. Okay?
So if you're using the belt, what are you doing with your hands? You're just holding it in place?
Essentially, I'm trying to hold it in place and just make sure I have good pressure so I get distraction, but that's it.
But you're not assisting him in getting
No.
it any further.
Okay? So try those out.